Good morning, everyone, and welcome to the Mental Health Tips of the Week. Today, I am joined by Allison, our front desk receptionist, and a clinical mental health student. And I am Lily Smith, the owner of The Traveling Therapist and a licensed clinical social worker. So today's tips of the mental health tips of the week are all about 5 questions that you should ask yourself if you are experiencing a significant change in your mental wellness. Some of the changes that you might be considering when I say this is waking up and experiencing depression like you've never experienced before, or out of the norm levels of depression, suicidal thoughts, thoughts of self-harm, thoughts of harming others, things of that nature. So we're going to explore these 5 questions that you can ask yourself to see what has changed in your life and your situation, and how you can address the change in a healthy manner to prevent a catastrophic situation like ending up in a psychiatric hospital or in an emergency room because you tried to harm yourself or someone else, etc., etc. So we're going to jump right in and let's get started.
All right. So the first question that you want to ask yourself is, has there been any changes in your medication in the past 3 months? So by medication, we mean it could be as simple as birth control. It could be like a psychiatric medication, something for bipolar or depression or anxiety. It could even be a dementia medication. So just changes that have happened within the past 3 months.
Yeah. Really, the studies show, and us here in the clinic have noticed over the last 5 years that we've been open, that medication changes are one of the main causes of significant cognitive change, especially when you're first getting used to the medication. So if you're noticing that you had a change in your meds, whether that is they took away medication or they added medication within the last month or so, and you're starting to experience any of the symptoms that I mentioned before, you should immediately address that with your psychiatrist or whoever actually gave you the medication to begin with or is managing your medication. I will say, and we were talking about this, it is not always possible to get immediate help from your psychiatrist because sometimes they can be very overwhelmed with phone calls and with visits. If your symptoms are to the point where you are actively having suicidal thoughts, actively having thoughts of harming others or yourself in any way, do not wait. Please go to the emergency room or go to an emergency clinic, like one of those like local smaller clinics, and seek advice on how to manage the medication from a provider there. Try your best not to make any changes until you've been seen by somebody who can guide you on what is the most efficient and healthiest way for you to make the change. But you definitely should be looking for help as soon as possible. Another thing, of course, that we recommend is, as the process is going, you can also reach out to the local crisis hotline. And if you have a therapist, or if you don't have a therapist, find a therapist. If you do have a therapist, reach out to the therapist. So that's what we recommend in the event that a medication has changed and you're starting to feel symptoms of severe cognitive changes. Like I mentioned before, whether it's self-harm, whether it's suicidal ideations, whether it's harm to others, whether it's severe depression, etc., etc.
And that was one thing we talked about earlier too, is you know yourself best, right? So you're going to notice those changes within yourself, and this is a time to really advocate and make sure that you're seeing somebody immediately.
Yes. And you make it, what we were talking about earlier was going along the lines of like, you may talk to your psychiatrist and your psychiatrist may say, you should stick to the medication. You'll be fine. You just have to work your way through it. Again, you know yourself best. if you are actively suicidal, you should not continue the medication. You should seek a second opinion. You should contact your PCP or go to a emergency clinic or something of that nature, because the psychiatrist may pause. Psychiatrists get phone calls all day, every day about side effects to medication. Psychiatric medications tend to often show some sort of a side effect. So the psychiatrist may not always have the mentality of this is urgent. They might have more of the mindset of this is normal, happens all the time, you're going to get through it, it's fine. You know yourself best, so you need to know if this is so persistent that you are overwhelmed by it. Don't just take the first advice that you get. Try to advocate for yourself as much as possible. We're not trying to advocate for people to go against medical advice, but we have seen it multiple times where people are advised to continue the medication and they do end up inpatient in a psychiatric hospital because they do end up self-harming. So you have to be able, again, this is why we're asking these questions to ourselves. You have to be able to gauge
the severity.
Is this bad enough that I am actively suicidal, like I am actively suicidal, or I'm actively thinking of harming other people? So be mindful of that.
So you did mention to not continue that medication, but remember that is within your doctor's suggestions too, because you don't want to just totally stop the medication. You want to wean off of it. And so having somebody monitoring you while you're doing that is important, which is why we say immediate advice from the doctor.
Yes.
So the second question that you want to ask yourself when you're assessing these symptoms is, has there been a significant life change within the past month?
Right. And what we're talking about there is, have you recently lost a job? Have you recently had a divorce? Have you experienced domestic violence for the first time? Have you had a baby recently? And something that I was telling Allison about this while we were processing what we were going to talk about is when I had my daughter, I started birth control almost immediately, and I experienced severe mood swings, like nothing I had ever experienced before. I did not recognize myself. I did not understand what was happening to me. I was becoming extremely aggressive towards my spouse, towards my baby. I was worried for the safety of my baby. I was driving recklessly. My mood was totally out of sorts. It was not me whatsoever. And I did what I am advising you guys to do. I stopped and I asked myself, what has changed that could possibly have caused this to happen? And I came up with two answers. I had the baby, so I may be experiencing postpartum depression. And then the second thing was I just started birth control after well over 2 years of not having it. So I immediately called my OBGYN, and they were able to get me in, and they were able to change my birth control to something different, and my mood completely transformed. I felt a lot more like myself. I was a lot more in control. I was back to me. So it can be something that you may not even think is happening, because it's a happy situation. We had a baby. It was beautiful. But I was not okay. So life changes can be things that may be good, things that may not be good.
Mm-hmm. And you mentioned with the birth control, and it made me think through like other medications and stuff too. It's important to find the best fit of medication for your body. So a different birth control might not have the same side effects on two separate people.
Which is what happened to me.
Yeah. And the same thing goes for, I know, for antidepressants as well. Mm-hmm. Everybody's going to react to them differently, and that's why it's important not necessarily to cut them out, but to go in and see what's going to work best for you. So the third thing that we had discussed was if there's any change in your routine or your habits, if you're noticing that you're doing things differently, you're isolating, maybe you're eating more, maybe you're eating less, maybe you're spending more time watching TV, things like that, that are out of your regular routine in life.
Right. So if that's happening, and if that's the one that, it's a yes, then the recommendation at that point is to usually to seek out support from a counselor, from a therapist. And of course, we're going to say that because we're therapists. But if you don't want to look for support from a therapist, then other avenues can also be, you can talk to somebody that you trust, that you feel has good insight into ways that you can help yourself and that you can cope with what's happening. That can be a religious person, like whether it's a pastor, whether it's a rabbi, whatever. It can be a mentor that you may have a good relationship with. It can be a parent. It can be a best friend. But basically what we want to emphasize is that if you're experiencing significant changes in your eating, significant changes in sleep, significant changes in your interest in daily tasks and things that you used to enjoy doing, you are checking off the boxes for clinical depression. So we do recommend that you don't try to do it alone. Seek support and help, because there is something happening clinically within your brain that is causing those changes. So whether it's outside of therapy or in therapy, look for resources and support.
So we also discussed if there's a change in the substance quantity. A lot of people don't think through. This could be you are increasing substances, but it could also be you're decreasing substances. So this could mean alcohol. Maybe you've been having a drink every night before bed to help you fall asleep, and your New Year's resolution, it's coming up, is to stop drinking. Well, if you're used to using that to help you fall asleep, then your body's not going to like you just completely cutting it out, and that withdrawal can cause these depressive symptoms or anxious symptoms. And then the same you said is also true when it comes to smoking as well. And these aren't things that we realize when we're lessening the substances.
Yeah, so it's a wonderful thing to work on managing substances that we may be using, whether it's, obviously smoking is not a substance, but whether it's smoking or alcohol or drugs, etc., etc. It's wonderful that you're taking that step for yourself. It's obviously something that we don't ever want to discourage. However, you do have to be aware of the fact that you're essentially changing the chemistry of your brain, because these substances have been actively changing the chemistry of your brain. If you look at a person, if you look at a person's brain who has been actively drinking for several months, several years, you will notice that their brain shows signs of the alcohol use. Same with drugs, same with smoking. So our recommendation in that aspect is, if there's any changes that are happening, two things. Number one, you probably are going to want to talk to a primary doctor or a psychiatrist, because you're going to want to maybe get some support on a medical level, like medications to help you wean off the alcohol, medication to help you wean off the drugs, or the cigarette. So you might want to reach out to your primary doctor and talk to them about your goals and your plans. And then the second thing, of course, is we always recommend the support of a therapist who can help walk you through the process by helping you build the coping tools that you're going to need to supplement. Remember that most of the time we use substances like alcohol, drugs, even smoking, to self-medicate and to cope. We don't usually do it only for the fun of it. It becomes one of those things that's a comfort and a support for us during times when we're anxious, depressed, having difficult times at home, things like that. So you're going to want to, whatever changes you make on it, you're going to want to know that there's something else that you can put in place that will kind of compensate for what you're taking away, so that you then don't start feeling the depression taking over, suicidal thoughts, self-harm thoughts, anxiety that's out of control, things like that.
Mm-hmm. And a therapist would be able to help monitor you, to help you just feel safe within this new process too.
Yeah, and you can process it with them. You can talk to them about relapses, you can talk to them about your feelings, and it's all private, so.
Absolutely. So then the last thing that we discussed was if there's like regular bullying happening in your life, or regular domestic violence, or PTSD, just anything that kind of has that trauma attached to it that's happening on a regular basis.
Yeah. So if you've been experiencing traumatic events on a regular basis, and again, it doesn't have to be what I call the big T, so like life or death sort of thing. It can be something that's just emotionally difficult all the time. Mm-hmm. Like bullying, the person may not be bullying you to the point where they are telling you to actively take your own life, but the bullying may be
it kind of builds up.
Yeah, may be building up, or may be just chronic enough and psychologically difficult enough and traumatic enough that you start to notice that it's taking a toll on you, and then you're having those negative thoughts and those thoughts of self-harm and things like that because of it. So pay attention to situations that may have been pervasive, so that may have been recurring in your life, that maybe, especially as you start to go into the end of the year and the holidays, maybe taking a bigger toll on you that they used to. And obviously the recommendations for that is seek out support from friends and family, seek out support from local resources, like United Way 211 is a good resource. Your local therapist is a good resource. If you have a therapist at school, that's a good place to start as well. So
if it becomes a crisis situation too, obviously our crisis hotline is that's going to be a great bet for you.
Yeah, and by the way, we'll put the number for the crisis hotline on the description of this video, so you guys have access to it as well. And then we have one last bonus.
Yeah, so the bonus is really just the holidays are coming up. And so we kind of have to be nice to ourselves, because the holidays do exaggerate everything that we're feeling. It's a really high emotion time. Mm-hmm. We're reflecting on the year. We're reflecting on things that have happened, and we're looking forward to the next year. And a lot of us are spending a lot more time with our families than we normally do. So that change and these emotions, they're going to have, things are going to be more present in your life that you're not used to.
And you may not feel it as much in Florida, but you will feel it. There is such a thing as seasonal depression. And as the weather changes and as the year ends and you start to realize that maybe you didn't accomplish as much as you wanted to, maybe you didn't meet all the goals that you wanted to, maybe you're finding yourself more alone than you were before, or just as alone as you were before, all of these things combined can definitely exacerbate the feelings of depression, can exacerbate the feelings of wanting to self-harm or do things that may not be good for you or for others. So this is just a time for reflecting on what am I doing more than anything. The recommendation for that, and the recommendation overall has a final thought, is this is a time to consider, what are the things that I do every day to support myself emotionally? What are the things that I feel I am lacking in or that I'm missing in my life that need to be supported? So, for example, I'm really good at managing my stress because I work out and maybe I journal, but I am not handling work as well as I used to before, and I wish I could talk to someone, or I wish I had more support from my family about it, or I wish I could go to my supervisor and have someone, a point of contact at work that could give me feedback and support. So look for areas in your life that are doing well and continue to like build on that, and then look for the areas that maybe you need additional support in. And this is a really crucial time for that, where you can go look for that.
So more than anything, we say seek guidance. You don't have to do all of this alone.
Yeah, definitely. And that's it for us for today. And I hope it was helpful. I hope that you guys found the information useful. And obviously, as always, we love your comments, your feedback. If you have other points that you would like us to do the mental health tips on, feel free to reach out and let us know. And follow and subscribe if you like our content. And other than that, I hope you guys have a wonderful Friday and take care.